We're going to bring up Dr. David Okonkwo. He is a professor of neurosurgery at the University of Pittsburgh and the head neurosurgeon for the Pittsburgh Steelers. And he's going to talk to us about sideline emergency in athletics and management of spinal cord injury.
Okay. In 6 minutes, I'm going to explain to you what we did for Ryan Shazier when he sustained his thoracic spinal cord injury in December of 2017. And I'm very grateful, our nation is actually grateful for Bill Knight. Bill Knight was there in Cincinnati in 2017 and helped me care for Ryan Shazier in addition to being part of the team that saved Damar Hamlin's life. And what I would say is that when people ask me, why do I do this? Why do I spend somewhere between 20 and 25 weeks a year working for the Pittsburgh Steelers? It's because if we can set the highest standard at the NFL, it'll have a trickle-down effect. And in my opinion, it doesn't work without neurosurgeons. Neurosurgeons are a vital contributor to this enterprise. And we see so many of our orthopedic colleagues engaging in their communities and communities to local sports at the high school and college level. And the more neurosurgeons we have engaged in this, the better it will be for our communities. We train for this. We do this every summer where we get together as a team and go through exactly what it is that we need to do. So in December 2017, Ryan Shazier had a helmet-to-helmet hit that had a helmet to backside hit that left him as a T9 Asia A paraplegic. And it was obvious on the field. We actually did not do C-spine immobilization because it was obvious to us on the field that this was not a cervical spine injury. It was clear from his neurologic exam that it was a mid-thoracic injury. And because we trained for this, we were ready for this. I happened to be there. I accompanied him to the hospital. But when we get there, what are you going to do? And we have strong protocols and high expertise when it comes to what you do on the field. But what do you do when you get to the hospital? There's substantial variation after that. So I'll just explain to you quickly what we did. But there are basic questions. Who's the captain of the ship? This was in Cincinnati. So I'm sitting there in the trauma bay in Steelers gear, surrounded by a bunch of strangers, trying to just quietly say, hey, maybe we should consider this and maybe we should consider that. But then my great friend Joe Chang showed up, and then it got significantly better from that moment forward. But I was lucky enough to have the right partner and the right colleague in that moment. And then Bill Knight stepped in the ICU, and Jack Palmer was the ER physician on the sideline with us and in the ambulance, making the phone calls, getting everything ready and set up. But these were the management decisions that we had to think through, and what were we going to do? So I'm just going to go through each of these very quickly, and I'll just say, do you have a protocol in place to guide this process in your institution? And you can make this same application to the person who's injured outside of the context of sports as well. And from my perspective, what we did for Ryan Shazier was the amalgamation of everything I had learned from the 1,000 prior spinal cord injuries I had taken care of. If you had asked me 10 years ago, can someone with idiopathic scoliosis play football? I would say yes. If you asked me that question today, I would still say yes. But it turns out that Ryan's idiopathic scoliosis was the culprit in his spinal cord injury. And if you understand scoliosis, you understand that there is hypoplasia on the side of the concavity at the apex of the curve. And that is where his fracture was. And it was that fracture that stung his spinal cord. At the time, he didn't have active neural element compression, so we didn't have a reason to operate immediately. Instead, we brought him to the ICU and began medical management. However, over the ensuing 24 hours, he regained some function. He converted from an Asia A to an Asia C. And on the morning of post-trauma day 2, he went back to being an Asia A. And it was at that moment that I knew something had changed. We repeated an MRI and found the interval development of an epidural hematoma, now causing spinal cord compression and worsened edema inside of the spinal cord. It was at that point that he was already being prepared for transfer to Pittsburgh. I didn't know you could get helicoptered from Cincinnati to Pittsburgh. Turns out you can. So we put him in a helicopter, brought him back to Pittsburgh, and did the surgery in Pittsburgh. So I did a transpedicular approach, evacuated the epidural hematoma, gave the spinal cord space on the side of the concavity by getting rid of the pedicle on that side, and did a short segment fusion. Were we going to give him steroids? Huge controversial topic. Fact of the matter is, if you understand the data that underlies this, you know that back in those days of the NASCAS trials, it was young males with incomplete injuries who benefited from steroids. We're not going to put the world-class elite athlete who's 25 years old at risk from steroids. You better believe we gave him steroids. We cooled him. And in Cincinnati, they have the Arctic sun. So Bill and I spent 24 hours figuring out how to deal with the horrific shivering that was in place, but we knew what we were doing was trying to maximize the likelihood that he would recover from injury. Back in 2017, it was still a MAP management protocol. We have now switched to spinal cord perfusion pressure management with lumbar drains and measurement of intrathecal pressure. That was not a practice that I had in place in 2017. We actually implemented that in May of 2018. So he was managed by MAPS, but now we would do it by spinal cord pressure perfusion management. And then it was made very clear to me that anything and any resource that I needed was at my disposal. So he did 29 dives in a hyperbaric oxygen chamber acutely. We put him down in a hyperbaric oxygen chamber 29 times. We put him on omega-3 fatty acids. We threw the kitchen sink at him. And then the next thing is that he got what no one gets under insurance in the United States of America. He got 6 weeks of inpatient rehabilitation. He had over 130 outpatient therapy sessions when the average spinal cord injury patient gets 20. And over the course of time, he went from a T9 AJA on the field to walking out to present the Steelers draft selection to being able to do box jumps. And in fact, over 9 months, he regained, and he is now an AJA E and has a perfect motor score on his AJA exam. We had excellent on-field management. We had fantastic collaboration inside the ICU to maximize what we could do for him. I was given the resources that most patients with spinal cord injuries are not given, which is something that we should address at the public health level in this country, because when you assign significant resources, you actually save even more resources down the road. And if we are resourced to take care of this patient population, we can do great things. And in fact, this athlete achieved a significant recovery. If you want to read a fascinating book, he wrote a book about his experience, and it gets into stoicism and his whole philosophical approach on life. This guy is like a fascinating human being, and he's giving back by creating a foundation that delivers to patients the gaps in resources that he was able to achieve, but that the patient with a spinal cord injury in the United States doesn't get under insurance policies today. Thank you very much.